Hi everybody, Dr. Daniel, and today I'm talking about, does allodynia occur with migraine? Allodynia comes from the ancient Greek word allos, which means other, and odun, O-D-U-N-E, which means pain. Clinically, it refers to pain produced by non-painful stimuli such as touch. Normally, it does not hurt to touch the head or the brow or the temple, but with allodynia, a simple touch to the head or temple may be perceived as being painful. Allodynia is like sunburn. Normally, if I touch my arm, it doesn't hurt, but after a sunburn at the beach, my arm is painful to touch. That is what allodynia is like. What is allodynia with migraine? Allodynia with migraine is pain from touching or stroking the skin that occurs late in the course of a single migraine or frequently with chronic migraine due to medication or use headache. Touching, stroking, or applying thermal, hot or cold change to the skin may produce this abnormal painful sensation. It may be called tactile allodynia. Allodynia is a neurological term used for pain a person experiences from non-painful events like wearing glasses, brushing the hair, touching bed sheets, or wearing a tight ponytail, all experiences which normally would not cause pain. The pain occurs anywhere in the body where there are pain fibers, but especially in the scalp, the neck, and head area. Allodynia is a neurologic phenomenon that's confusing to migraineurs as what's causing it. Allodynia is limiting and disabling. I'm going to list a series of causes of allodynia. Touch or light pressure from a belt or a bra strap. Mechanical allodynia from motion across the skin from light massage or touching fabric. Thermal allodynia from hot or cold stimuli. Combing, washing, or brushing the hair, pulling your hair back like in a ponytail, shaving, showering, wearing contact lenses or glasses, wearing necklaces, earrings, or tight clothes, bathing or showering, and water hits your face, resting your head on a pillow, resting your head on the right side with the same side as the pain of your migraine. Allodynia comes in stage 4 of a migraine attack called central sensitization, which is usually 3 or 4 hours after the onset of a migraine and lasts up to 72 hours. Migraine lasts up to 72 hours. Central sensitization is a neurological term indicating hyperexcitability of cerebral neurons due to exposure to the inflammatory neurochemicals neurokinin A, substance P, and calcitonin gene-related protein, which is abbreviated as CGRP. The normal time course of migraine. A single migraine attack, according to the International Classification of Headache Disorders 3, states that duration of migraine is 4 to 72 hours. Episodic migraine is defined as less than 15 migraine headaches per month. Chronic migraine is defined as more than 15 headache days a month, 8 of which have migraine features. 80 to 90% of persons with chronic migraine have a headache syndrome from overtreating with analgesics, caffeine, triptans, opioids, or butalbital, and that's called medication overuse headache. Medication overuse headache was formerly called rebound headache. An attack of migraine has 4 stages. Number 1 is trigeminal activation. 2 is neurochemical release. 3, arterial vasodilatation, and 4, central sensitization of the thalamus, which is the pain center in the brain. In general, patients with an attack of migraine are at stage 3 in 2 hours, and after 2 hours more after that, about 3 to 4 hours after the onset, they're at stage 4. Thus, patients with long-duration headaches lasting more than several hours spend most of their time in stage 4 central sensitization. Patients with medication overuse headache are continuously in stage 4 central sensitization, which causes allodynia. Now, taking a triptan at the onset of the migraine will stop the release of these neurochemicals and should hopefully keep the patient out of going into allodynia. With episodic migraine, the allodynia clears when the headache ends. and the offending neurochemicals are metabolized in the body and excreted in the toilet. For a single migraine, this is usually allodynia clearing on the fourth day after a migraine attack. The same thing occurs during treatment of medication-induced headache when the patient is detoxed off of analgesics, caffeine, or triptans, and in time the offending neurochemicals are metabolized and the headache and the allodynia clears, and then the patient is not so touchy and touch doesn't any longer cause pain. Thank you very much for listening to this. Listen to me on Podbean for other talks on migraine. Please click like and subscribe down there so we can follow each other. God bless all you people who have migraine, and I will see you again on the next talk.